Why a good night's sleep feels like a recharge for your body and mind. During Sleep Awareness Week, we turn our focus to a condition that stealthily steals quality sleep from millions: sleep apnea. Sleep apnea disrupts breathing during sleep, leading to numerous awakenings throughout the night. This condition is most commonly seen in its obstructive form, where the airway collapses or becomes blocked during sleep. This can cause loud snoring, sudden awakenings accompanied by gasping or choking, and a restless night's sleep. But the implications of sleep apnea stretch far beyond just a noisy inconvenience. Imagine waking up feeling exhausted every morning, or finding yourself irritable and unable to concentrate during the day. These are just a few of the daytime signals that sleep apnea may be lurking in your nights. The risks associated with untreated sleep apnea are severe, ranging from heart disease and diabetes to an increased likelihood of depression. Who is most at risk, you ask? Well, factors such as obesity, type 2 diabetes, and certain heart conditions can elevate the risk. Men are traditionally more likely to be diagnosed with sleep apnea, although recent studies suggest that women are often underdiagnosed. Lifestyle choices like alcohol consumption, smoking, and the use of certain medications can exacerbate the risk, making the throat muscles overly relaxed. If untreated, the repeated drops in blood oxygen levels during sleep can strain the cardiovascular system, leading to high blood pressure, heart arrhythmias, and even stroke. The fatigue caused by sleep apnea also significantly increases the risk of accidents, particularly on the road. But there's good news. Sleep apnea is treatable. Treatments range from devices like CPAP machines, which keep the airway open at night, to dental devices that adjust the position of the jaw and tongue. In some cases, surgery might be necessary to remove obstructions in the airway. Beyond medical interventions, lifestyle changes such as losing weight, cutting down on alcohol, and quitting smoking can also dramatically improve symptoms. The Independent is a globally recognized news brand, offering news, commentary, and analysis for independently minded readers. We aim to inspire positive change and remain committed to our mission of making a difference in the world today. Sleep apnea research and treatment are rapidly evolving fields with significant potential for future applications. Here are some of the key areas where sleep apnea research could have a profound impact. Telemedicine. The integration of telemedicine in the management of obstructive sleep apnea, OSA, is expected to improve access to diagnosis, increase adherence to treatments like continuous positive airway pressure, CPAP, and facilitate patient-centered care. Remote monitoring and home sleep studies could become more common, enhancing patient engagement and treatment outcomes. Personalized medicine. Advances in understanding the heterogeneity of OSA are leading to personalized treatment approaches. By analyzing individual pathophysiological components, clinicians can tailor treatments to the patient's specific needs, potentially moving beyond CPAP to include technical or pharmaceutical interventions. Artificial intelligence, AI. AI is set to play a significant role in sleep medicine by aiding in the identification of personalized treatment plans. It can help analyze sleep patterns, predict treatment responses, and develop new diagnostic tools. Implantable devices. Research into implantable medical devices, such as hypoglossal nerve stimulation systems, is ongoing. These devices could become smarter and more miniature, offering non-invasive treatment options for OSA. Lifestyle intervention. Lifestyle changes, including weight loss, reduced alcohol consumption, and smoking cessation, will continue to be important in managing or eliminating sleep apnea symptoms. Research into the effectiveness of these interventions will likely expand, providing more evidence-based recommendations for patients. These advancements aim to not only improve the quality of life for individuals with sleep apnea, but also reduce the associated health risks and economic burden. As research continues, we can expect to see more innovative solutions and a greater emphasis on comprehensive patient-centered care for sleep apnea. Sleep apnea has been extensively studied across various institutions and through numerous studies worldwide. Here are some detailed insights into where sleep apnea has been studied. Mayo Clinic research. The Mayo Clinic has conducted several clinical trials on sleep apnea, focusing on areas such as preoperative evaluation for obstructive sleep apnea, the effectiveness of the ReMEDy system in a real-world setting, and the unique sleep pathology of individuals of African descent. WebMD. WebMD provides an overview of the latest research on sleep apnea, including new treatments, diagnosing sleep apnea, and the connections between sleep apnea, dementia, and heart disease. National Heart, Lung, and Blood Institute, NHLBI. The NHLBI supported the Apnea Positive Pressure Long-Term Efficacy Study, APPLES, which helped establish CPAP as a leading treatment option for sleep apnea. The results have led to many other studies aimed at improving sleep apnea treatment. Sleepapnea.org. This organization offers information on how sleep studies work, the different types of sleep studies, and their role in diagnosing and optimizing treatment for sleep apnea. These studies and research efforts are crucial in advancing our understanding of sleep apnea and developing effective treatments. They involve a range of methods from clinical trials to the use of new technologies and devices, all aimed at improving the health and well-being of those affected by this common sleep disorder. In conclusion, recognizing and treating sleep apnea is crucial. It not only improves sleep quality, but also enhances overall health and well-being. If you or someone you know snores loudly or feels tired after a full night's sleep, it might be time to discuss sleep apnea with a healthcare provider. Remember, every night of restful sleep is a cornerstone of good health. Don't let sleep apnea rob you of your vitality. Take action during this Sleep Awareness Week to ensure that every night is a good night.